Hello, my name is Austin Schleidt. This is my 302 checkoffs for week 7 ID card. And then my 3x5 note card that I will be using. Okay, this is my patient. Please state your name, your age, and consent that you are being recorded.
Carrie Schleidt, 32263, 57 years old, and I consent to be recorded.
Okay, let's begin the assessment.
Hello.
Hello, my name is Austin. I'm going to be your nurse today. I'm coming in to just ask you a couple questions and do a head-to-chest assessment, if that's okay.
That's fine.
Thank you. Okay, so hand hygiene as I enter the room. Body symmetry is normal as just observing. Patient is calm. No signs of obvious stress from being in the room. And then, so I do have a couple questions for you.
Okay.
I need you to state your name, your age, and your birthday.
Carrie Schleidt, 32263,
Okay.
57 years old.
Okay, I'm going to check that with your name band.
Okay.
Thank you. And then I'm going to raise the bed up to appropriate working height.
Okay.
So this is where I would raise the bed. Where are we?
In the hospital or at home.
Okay. What time of day is it?
It's nighttime
Okay, and then why are you here?
for your final exam.
Okay. So A&O times 4. Skin is consistent with ethnicity. No obvious deformities or anything like that. Are you in any pain right now?
No.
Okay. So no pain stated by patients. Speech and hearing seems to be normal as just observing. Physical hygiene seems to be very well. And then I'm going to move on to my actual examination. So I'm going to take your vital signs first, if that's okay.
Okay.
This is where I would take blood pressure.
Okay.
I'm going to take oxygen saturation. .95. All right. And then I'm going to be checking pulse and respirations. Respirations were 15. Pulse was 84. Now I'm going to be checking your temperature. I'm going to be using this. Going to use it for the temporal lobe temperature. .98 degrees. And then now I'll be checking the skin for temperature. So skin temp within normal limits. Skin turgor by pinching and letting go. Normal limits. Then nutritional status of the patient looks good. No malnutrition. No obvious signs of malnutrition in the skin. No skin lesions or incisions noted, and Braden scale score would be a 23 out of 23. Next, I'm going to move on to the head. Okay, so I'm going to just touch your head and make sure there's no bumps or any kind of deformities, okay? Head is normal cephalic, no deformities or lesions on the head. Hair is evenly distributed. Facial symmetry is good, no facial drooping. And then I need to check the temporal arteries. Pulse is +2. And then I'm going to check your eyes, okay? Well, let's not drop my stuff. Okay, so I'm going to just shine a light in your eyes, okay? It's going to check your pupil reflexes. Eyes are perla, and then I'm going to ask you to follow my pen with just your eyes, okay?
Okay.
Eyes EOMA. Gaze is normal. Okay, so then I'm going to check your ears real quick, okay?
Okay.
Check the middle ears, external ears, no lesions once on right side, no lesions on left side, and then I'm going to do a quick couple hearing tests, okay?
Sounds good.
So the first one I'm going to do is called the Weber test. I'm going to hit my tuning fork. I'm going to put it on top of your head. I need you to tell me if you can hear it, okay?
Sounds good. Yes.
Okay. Next is the Rhine test. So they're gonna, when I hit it, I'm gonna put it behind your ear. I need you to tell me when you can't hear it, okay?
No.
Can you hear that?
Yes.
Other side.
No. Yes.
Next is the whisper test. I need you to cover one ear for me. And I need you to repeat the word that I put, that I say, okay?
Gold.
Okay, please cover the other ear for me.
Orange.
Hearing all within normal limits, bone conduction and air conduction within normal limits. Next, I'm going to check your nose, okay? So please tilt your head back for me. Septum is normal. Okay, so what I need you to do is cover one nostril and breathe in. Cover the other nostril. Patency bilateral and within normal limits. And then I'm going to check your sinuses, okay? Does this hurt when I push here?
No.
What about up here?
No.
Okay. Sinuses are good. Then I'm going to check your mouth real quick. So I need you to open up for me. Say ah for me. Tonsils, buccal mucosa, teeth, gums, and tongue are all within normal limits. Lips are not cracked and seem healthy. Then I'm going to check your neck, okay? Trachea is midline. Thyroid is well within normal limits. And then the carotid artery check. Bilaterally 2+. And then I gotta check your lymph nodes.
Okay.
So pre-auricular, post-auricular, occipital, submandibular, submental, the cervical chain, and then supraclavicular. Okay. All within normal limits, no swelling. And then I need to check your lungs.
Okay.
So I need you to turn this way and lean forward a little bit, okay?
Sure.
Thank you. One more time for me. Posterior breath sounds are normal. Now I need you to lay back for me.
Mm-hmm. Take it out. Just keep doing it. Go.
Take a deep breath for me. Alright, so I'm going to have to move your breaths, okay, just to get to the rest of the lung sounds.
Okay.
Okay. Now I'm going to check your heart sounds, okay?
Mm-hmm.
Okay. Switch to the bell side. One more time.
Can you just stay right there for a minute?
All heart sounds are clear. No extra sounds. Now I'm going to check capillary refill.
Okay.
So I'm going to squeeze on your finger.
Mm-hmm.
Less than 2 seconds. Then I want to check your jugular vein. So can you turn your head to one side for me? Okay. Within normal limits. No distension. Bilateral. So then I'm going to need to check your legs for...
Okay.
Come on. There we go. Oh, perfect, actually. So, checking for pre-tibial edema. No edema. No edema bilaterally. Going to check the post-tibial pulse. 2 plus bilaterally. Dorsal pedis pulse. 2 plus. Two plus bilaterally. Okay. So cardiovascular system shows no issues, and nothing with outside normal limits. Patient is on room air for, and then. Is there anything else? Is everything comfortable for you? Do you need me to get you anything? Any pain right now?
No, I'm good.
Okay, do you need me to do anything for you while I'm in here?
No, I'm fine, thank you.
Okay, thank you. Then I would lower the bed before I leave and hand hygiene again. Okay, now I would be doing my report. Okay, so introduction with patient was normal, no signs of stress within patient. Body position was normal and seemed calm, no stress shown with movement or nonverbal signs. Speech was normal, hearing was normal. She was ANO times 4, could follow commands. Speech and hearing were within normal limits upon just entering room. Personal hygiene was good. Vital signs, I would have a blood pressure if I took blood pressure. Temperature was 98. Pulse was 85. Respirations was 15, and pulse ox was 95. And on room air. Skin was normal, normal temp. Turgor was within normal limits. Color was consistent with ethnicity, and no skin lesions noted, and Braden score was 23 out of 23. Head was normal cephalic. Hair was evenly distributed. No lesions noted on head. Facial symmetry was normal, and temporal arteries were 2 plus. Eyes were perla. Gay accommodation was good. Eyes were also EOMI. Ears, no external and middle, no signs of lesions. Hearing for Weber, Rhine, and whisper tests were all within normal limits. Nose septum was midline. Patency was good within normal limits bilaterally. Sinuses showed no signs of pressure or pain, and temporal arteries or temporal pulses were normal. And then mouth, lips, teeth, buccal mucosa, gums, tongue, and tonsils were all within normal limits. Neck, moving on to the neck, trachea was midline. Thyroid was within normal limits. Carotids were 2 plus, and lymph nodes, preauricular, postauricular, occipital, submandibular, submental, and cervical chain and supraclavicular were all within normal limits. Patient was on room air. No respiratory effort was shown. Breathing was easy and normal. Lung sounds were clear bilaterally, posteriorly and anteriorly. No cough, no mucus sounding in the lungs. Deep breaths were easy. Skin color was normal, so no oxygen deficiency. Cardiovascular sounds were normal. Apical pulse was normal. No irregularity sounds. Was normal, and then JVD, no jugular vein distension, no edema in legs, bilaterally, Post-tibial pulse was 2 plus, bilat, and dorsal pedis pulse was bilat 2 plus. And capillary refill was less than 2 seconds.